All right, so we've hit on this earlier, and I think it's worth hitting on again. All types of back pain have something in common, regardless of the diagnosis or the type. There's inflammation associated with it. That's why most common treatment is anti-inflammatories. So let's try to dig a little bit deeper into understanding what inflammation is and how can we say that that has to do with all back pain. So as mentioned earlier, inflammation is part of the healing process. So anytime a part of your body, in this case a soft tissue, whether it's a nerve, a tendon, a ligament, a bone, a muscle, gets physically stressed out beyond its capacity to handle the load. In this case, the load would be either friction or weight or pressure, pulling, pushing, straining, all that stuff. If it's beyond its limit, it starts to damage the cell, and the cell dies. And the body is really good at repairing those cells. And so it goes through a normal 4-step process. First step is called hemostasis. Essentially, it's stopping the bleeding, which is where you see bruising. If it's superficial enough to see it, you would see bruising. If it's deep in your spine, you're not seeing any of that. But again, all physical stress causes phase 1 to happen, where cells die and the body has to stop the bleeding, essentially, and then move on to phase 2, which is inflammation. Inflammation usually lasts between 3 and 20 days, and essentially its job is to remove the dead tissues from the area so that the body can create new framework for new cell growth. And then that moves on after 20 days to the phase 3, which is called proliferation or granulation. And then phase 4 is remodeling or maturation. And so we know that inflammation is a vital part of the healing process, yet it is something that we treat and we want to stop to give people pain relief, which is good in the short term, right, to feel better, but it's not addressing the thing that's causing the inflammation or the damage to happen in the first place. So all back pain involves some level of inflammation. Commonly, the focus of the treatment is to reduce the pain, treating only the inflammation, but does not fix the mechanical problem that's occurring in the body. And this can actually delay the healing process. This is why we don't take anti-inflammatories after a surgery, because it delays the healing process. The role of inflammation is a natural defense mechanism that is triggered whenever the body tissues are damaged in any way. So inflammation can occur in response to physical trauma, which is in this case what we're talking about, intense heat, irritating chemicals, as well as infection by viruses and bacteria. In this case, we're talking about physical trauma, and it's cumulative trauma. It's not the car accident type of stuff we're talking about. It's my hip wasn't moving for 3 years and it caused my back to move more and more and more, and now I've got physical trauma to my back, and the back is trying to heal itself. So the inflammatory response, number 1, prevents the spread of damaging agents to nearby tissues. And number 2, it disposes of cell debris and pathogens, which then allows number 3 to happen, which is setting the stage for the repair process. So it's a vital thing. The bottom line is you need inflammation, so you need to stop trying to mask it and address what's causing the damage in the first place. And that is the key. How do you get rid of inflammation then? You should be asking yourself, and that's what this course is going to be designed to teach you. So the bottom line is you need to reduce or eliminate the physical trauma / stress / friction / movement that's causing your back to get damaged. That's going to be done by improving the motion in the areas surrounding the lower back, because the entire body works together as one kinetic chain, one biomechanical reaction. And so I'm excited to get into some of that with you here as we move forward and get beyond this motivational kind of demystifying the myths that you've been told. And then we're going to get to the good stuff here in just shortly.